Hello everybody, my name is Santhi Swaroop Vege. I am the director of the Pancreas Clinic at the Mayo Clinic. Many of you may be knowing about this Pancreas Clinic. This is one of the most renowned pancreatic diseases clinics in the whole world. When you look at the Pancreas Clinics, quote unquote, at many of the prestigious institutions all over the world, the top-notch institutions, we stand out quite a lot compared to many of them in the following ways. A, we have very high volumes of patients with pancreatic disease alone who come to Mayo Clinic. We see anywhere between 1,000 to 1,500 new patients with the pancreatic diseases at the clinic. Also, many of the big institutions have biliary and pancreatic diseases clinics combined together, or when they have these diseases are run by surgeons or by endoscopists whose full-time job is to do surgery or endoscopy but also see the patients. What distinguishes the Mayo Clinic Pancreas Clinic, besides the volumes, is a very renowned model which I personally call as the hub and radiating spokes model. What I mean is, geographically we are located on a floor. The clinic is run by pancreatologists. Pancreatologists by definition are gastroenterologists or GI endoscopists who see pancreatic disease patients for most part of their time or a significant proportion of their time. These are the quarterbacks. And the patients are seen here, but radiating into this clinic are the pancreatic surgeons who practice mostly pancreatic surgery, interventional endoscopists who do specialized procedures called EUS and ERCP, interventional radiologists who can put the catheters into any of the pancreatic or surrounding organs, diagnostic radiologists dealing with sophisticated MRI scans, nuclear medicine scans, CT scans of the pancreatic disease. Then we have the pancreatic pathologists who exclusively look at the pancreatic resected specimens or biopsies, which are done in large number here compared to elsewhere. And we have basic science people. So with all this matrix of people and with the quarterbacks who are dealing with the patients right from the time they come to the time they leave the institution, with input from all these experts, that's what makes this Pancreas Clinic uniquely different from any other pancreas clinic at a large comparable institution. Next, now, this is not the only reason why you should come to Mayo Clinic. When you have a complex medical pancreatic disease, either a diagnostic dilemma or a treatment dilemma, the advantage of coming here is, in a very condensed period of time, the patient can complete the itinerary. By this I mean their disease is sorted out, the proper input is given, the proper endoscopic procedure or the surgical procedure is done. All this is done so quickly compared to any other place, and that's the reason people go and spread the word of mouth and other people come here. I'll give you an example. A patient with pancreatic cancer recently diagnosed comes to Mayo Clinic on Monday morning to see me in the clinic. If his CT scan that he brought from outside is satisfactory, and if we do the blood tests on Monday morning and they come in the evening saying that this mass on CT is looking like pancreatic cancer and nothing else, it is operable, it's not a benign disease, there is no need for any endoscopic ultrasound or ERCP and biopsies. The pancreatic surgeon sees the patient on Monday evening itself, and during Monday we get all the blood studies, get the surgeon see the patient, get the scans reviewed, prepare him to be okay for anesthesia. Patient goes onto the table on Tuesday morning. This type of condensed itinerary is not possible elsewhere. And then, if the patient is having a major pancreatic resection called Whipple, we can even do it laparoscopically, as some of you may have seen the video of Dr. Mike Kendrick, who is the world's topmost laparoscopic surgeon. And we have other surgeons who are equally good. So we have about 4 pancreatic surgeons here who have enormous experience in the pancreatic surgery. And you are very familiar that the results of a pancreatic surgery are directly dependent on the number of procedures performed by the surgeon per year. So you have 4 people to choose here whose numbers are as good, if not more, than any other busy pancreatic surgeon. So these are some of the reasons why you come to Mayo. Then we have the cutting edge technology, like not only we do endoscopic ultrasound and ERCP, and we have dedicated group of physicians who only practice their trade on a full-time basis, which is important. They practice it on a full-time basis so that they become perfect. But we also do very sophisticated procedures where we can put the scope into the pancreatic duct, into the bile duct, and directly see the disease, take biopsies, and then we can do more cutting edge things, like for inoperable pancreatic cancers, we inject chemotherapeutic agents directly into the pancreatic tumor, amongst so many other things. So if I have to sum up, say if I am a patient with a pancreatic disease, whether it is acute pancreatitis, chronic pancreatitis, neuroendocrine tumors, regular cancer of the pancreas, or miscellaneous diseases of the pancreas like autoimmune pancreatitis, if I am a patient or if I am a physician having a patient elsewhere, why would I want to go to Mayo Clinic, or why would I want to refer my patient to Mayo Clinic? This summary: high volume center, people from all expertise available, constantly giving input to the pancreatic center, clinic there. 3, the itinerary, however complex it may be, involving multiple MRI scans, endoscopic procedures, and then surgery, can be completed in a much faster way than any other place. And each one of the people who are doing that endoscopic procedure, radiologic procedure, or surgical procedure has proved himself or herself to be one of the topmost experts in the world. And lastly, the overall care of a patient, which includes many small things that go to form the big care, like the nursing care, the desk assistants, the laboratory technicians, and the flow, is the best at Mayo Clinic. So these are the reasons why either a patient should be referred to Mayo Clinic with a pancreatic disease, or the patient himself or herself may like to come here.